the customers you love and your favorite trends. Jill Digital is here, where your advertising friends will boost your social views with a trendy blend. With Jasmine Ofori guiding you, your success will never end.
Hello, we are live. We are live on Facebook and we are live on LinkedIn and on YouTube. This is Jasmine from Jew Digital, and what I do is I help coaches, consultants, and event hosts to, stay visible online using social media marketing. Today, I'm here with Gurjit from Joyous Childbirth. And I'm just going to hand over the mic to Gurjit to introduce herself. Hello, Gurjit. Feel free to introduce yourself.
Yes, hi Jasmine. Thank you for being here with me on the show today. And I welcome everyone to the show. I'm Professor G, that's what I'm commonly known as. And I'm a university professor as well as a registered nurse. And I'm really super passionate about helping women prepare for a natural childbirth. So that's in a nutshell, and we can get started.
Yes, thank you so much for that lovely introduction, Gurjit. We are going to be speaking today about natural childbirth options. So I've got a few questions to ask Gurjit, and if you've got anything to contribute to the conversation, feel free to come up using the StreamYard link that I've dropped in the comment section. Gurjit, so can you tell us a bit about natural childbirth options?
Yes, I will. And before that, we'll just get into what exactly is natural childbirth. Because if you look around, everyone is coming up with slightly different definitions and expectations. But basically, and I'm saying this because I heard someone say that, oh, a C-section is also a natural childbirth. And I, of course, didn't agree with that. So I'll just tell you my version of what I think is a natural childbirth. So, in a natural childbirth, basically things are going well. Mom is healthy, baby's in the has a normal size, and the expectation is that this baby can come out in a normal way, and the woman can have a normal childbirth, which means a vaginal birth. Also, the baby is between 37 weeks and 42 weeks. That's the normal period where it's very considered safe for the baby to have birth. And so 37 to 42 weeks ideally, and with minimal medical interventions. So minimal medical interventions, of course, refers to not having unnecessary drugs and interventions during the laboring process. And the woman is, in a situation where she can move around freely. She can try natural options like breathing and, other relaxation methods like showers, hot showers, etc. There's many, many more. And, at the end of it, she has a normal outcome without the use of interventions like forceps and, vacuum, etc. And the baby is obviously the baby's in the ideal position for birth, and baby it comes out very easily. And that's what I would classify as a normal, sorry, normal also, because some people also have this terminology, normal and natural. So that's what I would classify as a natural childbirth, where both the mom and the baby are, in the flow, and birth is, occurring without complications.
Thank you very much for that, in-depth explanation to, what is natural childbirth, basically. So, in terms of, the differences between natural childbirth and other birthing options, what is your take on that?
So the natural childbirth, we've just had a little overview of what it is. And other birthing methods, the main other one is a C-section. where the birth does not proceed according to the natural, way, like labor starts on its own and then progresses without complications, and the baby lady has a vaginal birth. That's a
Yes.
natural childbirth, right? The other one is a C-section, which is major surgery. And of course, there are reasons why someone would have a C-section. They could be medical reasons, and they could be reasons with the mom or with the baby. And nowadays I'm hearing that there is a little segment of the population who is choosing to have a natural, who's, so my mistake, who's choosing to have a C-section. And so that is the option that some people are trying to choose nowadays without properly understanding the risks associated with a C-section. And we will get to that in a bit. But if during the process of a natural birth, the baby, is stuck or is unable to come out, doctors may resort to using the vacuum, which is a gadget that is placed on the baby's head, and the baby is pulled out using suction, and the mom pushes the baby out. So it's traumatic for the baby's head, but at times, it can be an option because the baby isn't doing too well, mom is exhausted, and then the doctors have to choose that option. And the final one I want to talk about is a forceps birth, where the vacuum somehow doesn't succeed. They've tried, and somehow it isn't helping, and baby's not responding, baby's unable to come out. Then the next measure, which is considered a little more invasive than the vacuum, is the forceps. So the forceps, of course, is inserted around the baby's head, and the doctors extract the baby vaginally, and the mom tries to push. And so it's a combined effort where we help the baby out. So these are two or three options that I did want to speak about and touch on. And so we could talk about, like we've learned about these options, but we could talk about the benefits of natural childbirth. Why is it so important? And why am I so passionate about natural childbirth? Because there are many benefits for the mom. It's like the mom has benefits and the baby has benefits too. So the mom actually has physical benefits in the sense that it's less invasive on the body, less trauma for the body, and the mom can stay in the hospital, sometimes only 6 hours. Everything is good, and she has an opportunity to go home. Whereas if it's a C-section and she has major surgery, then she might need to stay there for at least 48 to 72 hours. Also, the risk of infection is much more, right, with a C-section, and the recovery is way longer. It could almost take 4 to 6 weeks for a complete recovery. Whereas with the natural birth, it's just like I mentioned, within a day, the woman is up and about, walking around. Also, the side effects. If you talk of the drugs, the narcotics, during a C section, narcotics is a must. They have to be given. And so, as a result, what happens? The mom has side effects and she has to cope with them. Whereas if the woman doesn't need any narcotics and she goes through birth without these medications, then she doesn't have those side effects. And finally, let's look at the finances. With a normal birth, when you're up and about, able to take care of your baby yourself, and you go home earlier, the drain on your finances is very limited. But with a C-section, you're in pain. It's hard to cope with the baby. You're taking all these pain medications. You stay in the hospital longer. When you go home, you need help, right? It's hard to function by yourself, and so you end up paying for that extra help, and that can also drain your finances. So now, if it's okay, Jasmine, can I talk about the benefits for the baby?
Yes, most definitely. Please feel free to do so.
Yes. So for the baby is born right away, natural birth, baby goes on the chest and starts bonding and breastfeeding. And that first hour after birth, we call it the golden hour. And the golden hour means that that is the, and some people say the sacred hour. These are different terms used. And at that time, it's the baby's quite wide awake, alert, and it's the best time to get baby started. But with a C section, that golden hour, the sacred hour, is generally not, allowed because baby's taken away, mom's getting stitched up. So that first hour is literally not available for the baby. So baby, in a way, cannot get the breastfeeding going right away. And also in a vaginal birth, when the baby is coming out, it's exposed to the mom's bacteria. And those bacteria can actually stimulate a healthy immune system response. And so the baby ends up having a really effective immune system. Whereas in a C section, baby's taken out right away and not exposed to mom's bacteria. So that's sort of like a negative, opportunity for the baby. As well as when the baby comes out with the natural birth, the lungs are squished, all the extra fluid comes out, and baby's able to breathe quite well when it's out. Whereas with the C-section, when we lift the baby out as is, most of the fluid remains in the lungs, and it does take extra time for the baby to get that absorbed and expelled from the system. So a little bit of extra respiratory difficulty might happen. So that's how the baby, reacts to both types of birth.
Okay, that's very interesting, Gurjit. Let me just check if anybody has got any comments in the comment section, or any questions to ask. Right now, I don't see any, so feel free to keep going.
Okay. So, do you have a question, or should I just continue?
Um, Sorry about that. Yeah, there was a problem with LinkedIn. It disconnected, so I had to reconnect it. So the audience that was supposed to join in, Gurjit, I'm trying to share it out again to get people to join in. The question I have is, you've touched a bit on the physical and emotional benefits for the mother, haven't you? Yeah,
Yes.
have, yes. Um, in terms of a birth plan, why is it important to be, very prepared in choosing a birth plan?
So this is a really important question because some people say, "Oh, birth plans doesn't make sense. Why should we have a birth plan?" And it never comes true. Now, let me tell you one thing. The birth plan has multiple purposes. One of the purposes of the birth plan, and that gets us into what exactly is a birth plan is simply a page where you write down your wishes for what you see, what you want to see happen during your birth. So, it could be the people in the room, it could be the lighting, it could be the sound system, the things you would like to see happen, and it could be related to birth also. When you want to clamp the cord, who's going to cut the cord, etc., etc. So the purpose of this birth plan is to let your care providers, your nurse, your doctor, or your midwife know about, what are your preferences, what would you like to see happen, because that way they are on the same page as you. They know what you like, and they will try to oblige you and have that happen for you. Okay. On the other note is, if there is, something that's not aligned with the birth plan, like something happens and they cannot continue with fulfilling your wishes, then you have options laid out. In case this happens, this is what I would like to see happen. So the birth plan is a really important document for you to communicate with your healthcare provider and let them know, what your preferences are. Now, choosing this, it's important because it's related to where you choose to have your birth. So if you are having birth in the hospital, obviously your birth plan will be related to the facilities, the options available in the hospital. They'll be according to that. And if you are planning to have a home birth, like if things are normal, everything's going well with you during pregnancy, you have the opportunity to have a home birth. And but of course, you have to make sure that your care provider can assist you at home. Suppose they say, no, we are only going to have, we are only able to conduct your birth in a hospital, then home birth may not be an option for you. But if your care provider is happy to, deliver your baby at home, then the home birth could be an option for you, and your birth plan can reflect what you would like to see happen at home. And so it's really important, according to me, to have a birth plan. And if it's in a birthing center, then based on what's available there, you can have your birth plan accordingly. But you would have to, for this, you would have to visit, or you would have to see the place or the room where you are planning to have your birth. Because according to that, you can establish your or write your birth plan.
Thank you very much for explaining that. It's better to be well prepared and know exactly what you're going into when it comes to having a birth plan and going through the birthing process. At least if even if things don't go to plan, at least you have a structure on how you wish for things to go. Thank you for that explanation. If you are interested in prenatal classes and you're a woman or you know somebody who is expecting, Gurjit is the best person to speak to when it comes to that. If you have any specific questions about pregnancy, feel free to come up and ask Gurjit or send her a message, and she'll be more than happy to assist you. I see OK Olua Timilehin in the building. Thank you for joining us. If you have any questions or any contribution to add to the conversation, please feel free to join us. Um, so I'm going to move on to the next question, Gurjit. Um, in
Yes.
terms of overcoming fears about natural birth, because people are scared that it's going to be a painful process and they'd rather go for the easy option or the less painful option. What would you say to somebody who's fearful about natural birth?
Yes, first of all, I'd like to just touch on the common fears that women have. And over the course of so many years that I've been practicing, some of the fears are pretty much consistent. Like many women have these fears. And one of them is the fear of pain, right? They're saying, oh, the pain I've heard is really bad. I don't think I can take it. That's one of the common fear. Others are afraid that, they want their baby to be safe. They say, what if something happens to my baby? Well, that's a huge fear. And then others are afraid that they would tear so badly because they could have heard from someone that, they tore very badly and it was so difficult after that. So they're afraid of the tearing. Somebody, it could be a simple thing like, someone could be afraid of pooping during the birth process. So what I'm trying to say is every woman has her own individual set of fears, and they could be specific to that particular woman. But there are some general underlying fears that many women do have. So, why are we talking about fears? Because I'm so glad you brought this topic up, because fears, they come to the forefront at the time of birth. And because of these fears, sometimes we end up with things that we are afraid of, right? All the things that we're really scared about, we end up experiencing them. So, you might say, okay, if that's the case, then this seems like a dead end. Like they're afraid that's going to happen. So, what on earth are they going to do? Let me tell you, there are so many strategies that you can use to get these fears out of your system. Because once these fears are gone, let me tell you, even the birth plan will work. You can have a birth without complications because you don't have these blocks in your system that are causing these issues for you. So I'll just share a couple of strategies that anyone could use when they have a fear. The first strategy is find out if what you're afraid of is actually true, because it may just be in your own mind. So you'll say, how do we do that? You can talk to people around you. Specifically, if it's related to something, to the birth process, you could talk to your care provider, your doctor, midwife, say, this is what I'm really afraid of. Is it true that this happens? And for all you need, the doctor say, oh, who told you that? That never happens. And then you're like, oh my gosh, I was just, creating havoc in my mind, thinking about that. And I was magnifying it, and I was exaggerating it, and I was enlarging it. Whereas the reality is that it's not even true. So that's the first step, is to make sure that what you're afraid of is real, and it's not just a figment of your imagination. The second thing that I would advise you is, if you're afraid of something, you can use a fear release method to calm yourself down and make sure that that fear has left your body. And there are many, many strategies for that. And one of the strategies I want to share here is, just feel the fear in your body, like think of what you're afraid of, and you'll find some part of your body gets tense and stressed and tight. So, scan your body. Where are you feeling the uneasy sensation? And wherever that is, just focus on that particular part of your body or spot, and then just do deep breathing. Just keep on breathing deeply while your focus is on that spot. And you will find, as you keep on breathing and focusing on that uneasy feeling will diminish in intensity. So it will become less and less and less and less. So, what are we doing? We are basically using our body, connecting it to the mind, and we are working with the mind and body together and releasing the fear. So this is super powerful. And then you start thinking, okay, I was afraid of this. And you will find the intensity of the fear has gone down significantly. And at times it could almost end up like, I'm not afraid of that anymore. So this is very, very powerful.
It certainly is, getting the right mindset ready for birth is so important because it can really affect the way that, we feel, and that can translate down to, our child or our unborn, baby. Gadgets, in terms of how you help people to relax in your prenatal classes, can you touch up a little bit on that?
Yes.
Expand on how you would get them into that zone where they can fully, grip all that mindset to help them in their journey.
Yes, yes. So there's a lot that goes into this, Jasmine, and that's part of the preparation for birth. So if the woman is weak and not physically fit, obviously that is going to influence the progress of her childbirth. So getting physically fit, super important, which means obviously eating the right foods and, performing the right exercises so that your muscles are also fit. Not only are the muscles well nourished, they're also well toned. That is super important. If that is taken care of, that's an important component of your preparation. And the other component is, we just talked about it, is releasing all the fears. And sometimes the fears could be related to birth, and sometimes they could be unrelated. But wherever they are, birth related or not related, they are going to influence your childbirth. So we talk about strategies about how to release all these fears so you're totally relaxed. Then of course, it's super important to know what you can do at the time of birth so that you are super relaxed at that time, and that's huge. All the different facilities, the different things you could use at the time of birth is all covered in the classes. And of course, knowing what to expect and knowing how to navigate each stage is super important. So basically everything that you need to know to prepare yourself and to have an exceptionally wonderful experience is all covered in the classes.
Oh, that's fantastic to know. So if somebody was interested in your prenatal classes, could you sort of talk them through the stages in which they can contact you and what they can expect, from the stages that you take them through?
Yes. So thank you so much. You have the contact information. I can see it on the slide, and they can book a call with me or they can email me. So both methods work. So if they have questions and they really want to know some other things, they can book a 20-minute call. That's free, no payment for that, and they can find out if what they're looking for they would benefit. And most of the times it's 100% yes, because all the things that they need to know, like I mentioned, to prepare themselves and whatever they need to know and do is all included in the program. So this way of either emailing me or booking time on my calendar, both are good methods to connect.
That's fantastic. Thank you so much for this insightful information. Let me just check in the comments to see if anybody would like to come up or ask any questions. Right now, I don't see anybody that wants to come up, so that will conclude our session, Gurjit. But if you could say one thing to somebody who wants to have a natural birth, what would that one thing be?
Yes, that one thing would be to take responsibility and plan for a natural birth by doing all the right things. And of course, attending the classes, because no one is a birth expert. Every woman is a professional. She could be an accountant, she could be a lawyer, she could be a teacher, she could be anything, but obviously she's not, fluent in the birth process, and it could be her first baby, and there's lots of things she needs to know about. So, taking responsibility and not depending on the doctors and nurses, or we'll see when the birth happens, or oh, it's a natural process, there's nothing to worry about. Those things are actually um, uh, they they make sense, yes, but the body that we have today is so different from the body that our forefathers have had. So, a lot of preparation and responsibility is a must nowadays. So, my only last thing is do not depend on anybody. Anybody. Prepare yourself, be self reliant, let your flow naturally like nature wanted it to be by doing all the right things, doing all the preparation, and actually experience the joy of childbirth, both for yourself and for baby.
Yes, that's fantastic. Definitely taking responsibilities and, owning our own birthing process is definitely very useful for us, and it keeps us vigilant as well. So thank you so much today, Gurjit, for being on this platform and discussing this. We will be delving into other, birthing topics in the near future. So thank you for listening in, Platine and OK. Thank you for coming in to join our stream. We had a technical problem. We had around 149 attendees, Gurjit, for the LinkedIn Live, but for some strange reason, LinkedIn wouldn't let me connect. So I had to start a new stream. That's the reason why we haven't had many people join. But thank you so much. The information you've provided is definitely going to be useful, and it's going to be recorded so people can listen back to it. That's it for today. I'm Jasmine Ofori. I'm the founder of Jew Digital, and if you've got any questions about social media marketing, you know where I am in terms of how you can find me on LinkedIn. But if you'd like to book a call with me, it's calendly.com/Jew Digital. Thank you so much for listening in, and I hope you all take care.
Thank you, Jasmine, and thank you, everyone.
Thank you.
We know the customers you love and your favorite trends. Joe Digital is here, where your advertising friends will boost your social views with a trendy blend. With Jasmine Ofori guiding you, your success will never end.